want to first thank David for allowing me to give this presentation today at the meeting. I think it's a very important topic, a pressing topic for all of us in urology. So we'll see how this goes. These are my disclosures. The objectives are to cover the facts, the fiction, and the fixes, what I believe are some fixes for physician burnout. Start with the facts. Physician burnout is occurring at an alarming rate. It's nearly 2 times the general population. It also has urologists ranked at second among physicians. We heard today that actually in a recent report, the urologists are ranked maybe the top among physicians in burnout. This initial report came from Dr. Sonnefeld in the Mayo Clinic Proceedings publication in 2015. In that study, he reported physician urologist burnout at 63.6%, and that was up from his previous study in 2011 at 41.2%. But as you can see, these studies were limited by the small number of urologists in each of those years, less than 140 urologists in each of those years. And this compelled the AUA then in 2016 to assess burnout in urologists. And the way they did that was to embed the Maslach Burnout Inventory, the MBI, into the 2016 AUA annual census. And the Maslach Burnout Inventory measures emotional exhaustion and depersonalization. And they were able to validate these answers in 1,100 practicing urologists. What they found was that the burnout rate among urologists, less than 65 years old, was 40.4%. So less than what Sonnefeld had shown in 2014 Mayo report, but comparable to the 2011 number, also comparable to physicians overall in the low 40% range, and still twice that of the general population. So a significant problem. The AUA data looking at burnout rates by age showed that the highest age group most susceptible to burnout was 45 to 54, so people in their middle years, their middle career, although really no age group was immune. The other thing they saw in the correlation was correlated directly with clinical work hours spent per week. And it was highest in urologists that were spending more than 50 hours a week in clinical work. It also correlated directly with the number of patient visits in a typical week and peaked out in urologists that were seeing more than 75 patients per week. And you talk to the full-time clinicians in this room or back home, and 75 to 100 patients per week is pretty routine. The fiction is that burnout risk is equal for all urologists. And we see this difference in, again, some of the AUA data. Looking at burnout rates by subspecialty practice, the burnout rate was highest in the urologists practicing general urology, and was actually lower in the subspecialists, particularly oncologists and pediatrics, which were measured. Other subspecialties were not measured in this report. There was also a correlation with a difference in urology burnout based on your practice setting. It was highest in physicians practicing in multi-specialty groups, but a close second were the single urology groups or the LUGPA groups like mine in Indianapolis. And this is a significant issue to all of us. It was interestingly significantly lower in academic centers, and possibly this is because in academic centers there's a higher percentage of urologists that are practicing in their subspecialty. The drivers for physician burnout are listed by many. I found the best publication by a group called MindGuard, and this is an organization that manufactures psychological assessment tools, including the MBI. And they said the 5 physician drivers for physician burnout were excessive workload, work inefficiency and lack of work support, lack of work-home integration, loss of control and autonomy, and loss of meaning from work. Now, they also proposed fixes for each of those drivers of physician burnout. And for each of them, they listed organizational level solutions and also individual level solutions that you can do yourself aside from what the organization may or may not do for you. And they had that for each of the 5 burnout levels, or for each of the 5 drivers of burnout. I'd like to share with you what I saw as 3 themes that emerged from that list. And that list, the themes included finding more free time, developing special interest or subspecialization, and utilizing team-based care. Now, when we start talking about managing time and building our team, I really think that as physicians we need to look beyond the doctor experience because, frankly, physicians are poorly trained in management. I think we have to look to the business world experience and find out how it is that businesses increase productivity, improve quality, improve customer satisfaction, train and retain staff, something we don't do well in our practices, and all the while increase employee or in our case, provider satisfaction. Now, 20 years ago, when we started merging group practices in Indianapolis, several of my outside business advisors told me that they're involved in this business coaching program called the Strategic Coach and recommended I get involved. And what I learned was that this was a business coaching program primarily for entrepreneurs, teaching entrepreneurs how to grow their business and increase their personal satisfaction at the same time. Imagine that. And they did it by getting entrepreneurs to move from practicing rugged individualism, they're wired just like we are, which is doing everything themselves, to collaborative teamwork. And this was a 3-year program with 12 quarterly workshops. One of the first workshops brought in the concept of the ceiling of complexity. And what that is, it's the wall or the ceiling that all organizations or individuals run into as you try to advance what you're doing. And as you keep trying, you work harder, you jump higher, and you still can't progress. And what that causes is frustration and disappointment and can lead to burnout. To break through that ceiling of complexity, we have to do something different. We can't just keep doing what we're doing or we'll get what we've got. And for us, the ceiling of complexity, I believe in urology and in medicine in general, is excessive workload, increased administrative burden, and the constant battle of a work-life balance. So to break through that ceiling of complexity, a couple of strategic coach tools that I think are really applicable here are the development of or identification of your unique ability, building a unique ability team, and use of the entrepreneurial time system. And I want to spend the next few slides talking about that. The entrepreneurial time system is taking a look at our days and dividing them into 3 types of days. They're focus days, free days, and buffer days. Focus days are days spent on revenue-producing activity. Free days are spent on pleasurable, non-work activities, and buffer days are spent with your team preparing for exceptional free and focus days. Number one step, I think, in reducing burnout is to plan your free days first. And this is a coach concept, is that each year, the beginning of each year, and you fortify it and recheck it every quarter, that you schedule your free time first. And you do it at regular intervals so you don't have a chance to burn out. Before you burn out, you go and take a break. And by planning those free days, they should be relaxing and rejuvenating without any work-related activities. That means you don't make rounds, you don't check your emails, and you don't finish the paper that you're working on. They are free days to be spent doing the things you want to do with the people you want to do it with. The next is to plan your focus days second. And those focus days are defined by days that are spent 85% of the time in revenue-producing activities that are really free from interruptions, that allow you to do your work. Just as we're free in the operating room, by the way, isn't listed one of the causes for physician burnout. It's the clinical work. But in the operating room, we really are buffered. We don't have a lot of interference, a lot of interruptions, because everybody knows you've got to stick to the job and get it done. We have to bring that same environment into our clinical work site in order to achieve the same goals. Last is to plan your buffer days. And those days actually turn into half days. They turn into a couple hours a week once you get good at it. But it's working with your team on a regular basis to coordinate and assign delegated activities while planning for exceptional free and focused days. Step number 2 is identify your unique ability. What is unique ability? It's the activity that you perform exceptionally well that brings you tremendous satisfaction and inspires you to do more. It's the work that doesn't feel like work. And for us in medicine, it's generally our core competency. It might be our niche or our sub-specialization or our passion. It's what you love to do and you really do best. And that's where we should be spending our time. Step 3 is to delegate everything else. And you do that by evaluating your workday and you determine what it is really needs to be done by you as a physician and what else can be delegated to your team members. The last step is to build your unique ability team. And that team really has 2 arms. It has an administrative team and a clinical team. We call it a backstage and a front stage team. The administrative team includes your check-in, check-out person in the office. It includes your surgery scheduler, the person who does pre-cert, all your billing and coding staff, your office managers. The clinical team is your front stage team. Those are the people that interact with you with patients. And working in coordination with them, it allows you to free up to spend time in your specialty area of interest and problem solving in areas that you want to spend your time in, while allowing your team members to take care of the other problems. And that team includes your medical assistant, your scribe, your advanced practice provider, and your phone and triage nurse. So in conclusion, Burnout in urology is real. The causes are many, and I think the fixes include scheduling free time first, finding your unique ability and special interest, and delegating everything else to your unique ability team so that we can continue burning bright without burning out. Thank you very much for your attention on this important topic.